Hello. Good morning. So, most of us would agree that the healthcare system is frustrating. Think back to the last time you went to the hospital or a clinic. I think you can relate to that. It's difficult to access, it's inconvenient, and it's frustrating trying to navigate through the maze of appointments and referrals, test results, waiting rooms, and all the meanwhile trying to decipher through confusing information about your health. That's the reality in our healthcare system, a system that's broken. You see, it doesn't matter where you live. The system doesn't make it easy for us to be healthy and to manage our health. And that's magnified in a state like Mississippi, a state where there's a limited healthcare workforce and where travel is necessary to gain access to healthcare. So in Mississippi, 65% of our state has to travel over 40 minutes to get access to a specialist. The healthcare system is difficult, but it doesn't have to be that way. We have an incredible opportunity to change that. And slowly, things are changing. And I want to tell you 3 stories that start to show that change that are happening right here. This is TJ. TJ was 16 when he was shot in a hunting accident. He was rushed to the local community hospital where there were only a couple of people working in the emergency room. See, that's normal for a community hospital. They work with limited resources, but they were doing the best that they could. But when TJ was brought in that night, despite the fact that there was not a trauma specialist or a surgeon on staff, he had an entire team there taking care of him. TJ's heart stopped 3 different times, but TJ was saved, and he's alive and well today. I can't say that would have happened if he had been in a traditional community hospital. This is Jackie. Jackie's a 47-year-old female who has diabetes. She monitors her glucose. She tries to eat right. She tries to exercise, but it's hard. It's hard to manage her disease. In the convenience of her home, though, she now is monitoring her health with a team of diabetes specialists, even though one doesn't even live in her community. So when she does a fingerstick glucose, a team is monitoring those results from hundreds of miles away, interacting with her, providing patient education and information. So for the first time in her life, Jackie's diabetes is under control. She's in control of her life, and for the first time ever. So this is Chris. Chris is 42 years old. He drives 2 hours to work every day. He can't take off from work to see a doctor because when he's off work, he doesn't get paid and he has a family to think about. So the reality is he goes without checkups and without health care. But now it's different. In his workplace, he can see a health care provider. He has health care, convenient and timely access right there in the workplace. So now he's in control of his health and getting preventive health care. So these 3 stories ended differently than we would have expected. In our traditional healthcare system, it would have failed them. A community without access to a specialist to take care of emergencies, a community without a diabetes specialist, a patient that doesn't have daily support in her home to manage her chronic disease, or an employee that doesn't have timely, convenient access to health care in the workplace. You know, where you live and work does determine your access to health care. But these ended differently because they all had telehealth, and health care was brought to them. So what is telehealth? Telehealth uses technology to connect people to health care, and it doesn't matter where you are. They can connect the 2 together. So I'm sure you're sitting here thinking, you know, that sounds great, but not for me. I want to see my doctor in person. And that this won't make any difference for my community or for the average person. But I'm here to tell you we're doing telehealth all over the state, and average people are having their lives changed, and we're saving lives. So let me tell you how this all started. It's been about 15 years ago that I started this on a concept. And this all came out of the reality as a nurse practitioner and as an administrator of an emergency department, our state's only academic medical center, that we were seeing people coming in from all over the state that had bad outcomes because of inconsistent healthcare delivery and delays in healthcare. So because of that, a concept was started of telemedicine. So a couple of us, as an extracurricular activity, started to develop this idea. And then we sat there on October of 2003 and started our first program in 3 community hospitals and their emergency departments to bring emergency specialists from our academic medical center to these rural emergency departments to change the healthcare for emergencies. The success of that program led to us adding other specialties, and community by community and specialty by specialty it grew. To now we have 165 partners throughout the state. We offer 35 different medical specialties over telemedicine and in 8 different types of locations. So in homes, in clinics, hospitals, even in the workplace. It doesn't matter where it is, we can deliver healthcare there. So it's grown from a simple solution to one problem to an undertaking of trying to develop a telehealth network for the state. It's an incredible opportunity that is thriving in our state. So nationally, we have a problem. We have a healthcare crisis, and our model of care is just not working. We have a looming doctor shortage and a growing elderly population that's plagued with multiple chronic diseases. And we've attempted to solve this by expanding or enhancing our typical traditional healthcare model, but we're expecting a different result. And can we even financially sustain that by just adding more clinics, adding more doctors, extending hours? It doesn't get to one of the major problems that we just don't have time. Who has time to sit in a waiting room? Who has time to go see a doctor? That's one of the biggest problems, but telehealth can address that. So we're challenged with trying to look at this differently, and we have a population that's thirsty to be healthier. They're wearing Fitbits and they're Googling and internet searches on how to be healthier. So we have a healthcare crisis. We have a tech-savvy population that's thirsty for more healthy information. So we have a perfect environment for a radical change in our healthcare system. So this is about using technology. And I can connect you to telehealth and a healthcare provider using all types of technology, whether it's your smartphone, a tablet, a computer, or in a telehealth-enabled clinic or hospital in your community. It can be connected anyway. You know, we use technology in all the areas of our life to make things more convenient and more accessible. Think about it in banking or in retail shopping or travel. We use it every day. At our fingertips on our smartphone, we use things to control our home remotely. We can turn the thermostat up and down, turn on our lights, turn on our security system. We deposit checks on our phone. We're a very tech-savvy population, and it's in our lives everywhere to make things more convenient and more accessible, which is how we should do it for healthcare. So let me give you a little picture of what this looks like, now that you know the possibilities here. So it's as simple as this. We have a 24-hour telehealth call center. It's staffed by physicians, nurse practitioners, nurses, and technology support staff. And this is where all the operations happen, where we schedule appointments for a telehealth visit. They can be scheduled, or if it's an emergency, we can connect you to a healthcare provider immediately. So it depends on the clinical use of what the technology is. So in some cases, I'm providing a tablet into somebody's home to manage their chronic disease. In another scenario, it's in a hospital, and I've got a wired telemedicine room in the emergency room. So if somebody comes in with a stroke, I can connect them to a stroke neurologist immediately to have life-saving intervention done early. So there's all types of different scenarios and how this is set up in the technology, but the basic workflow is the same. So I'm going to describe the situation of a child that's in a school-based clinic. So a child is sick at school, they go see the school nurse, and now they would call me at the telehealth call center, and we would connect through video. The parent from work can also connect in. So all of us are together in a virtual area, a virtual waiting room. So no more crowded waiting rooms with lots of people and waits and delays or even exposure to other illnesses. You come with one click into the virtual waiting room where you're greeted by our telehealth coordinator. Then I, as the clinician, would come in talking to the parent, the child, and the school nurse and ask them about their symptoms, their medical history. Tell me about your allergies. All the same things that happen in an in-person visit, but they're just done through technology. And then after that, I would go over and start an examination. This exam is not something that's a lower standard. This is about the same best care and the best healthcare providers that you would see in person. We just use technology to get the information. So with the exam, I would use technology to be able to look in the eyes and ears and throat, listen to the heart and lungs, and recreate what I need to be able to diagnose this child. And then, if needed, I would be able to prescribe a medication. I'd electronically send the prescription to the pharmacy of choice. When the mother gets off work and the child gets out of school, that's picked up and ready for them, saving time, money, and keeping people at work and at school. So it's really changing the future. So I'm telling you about technology that's here right now and being used all over the state. It doesn't matter if you're an aging, older person that needs health care and home, so that you can live independently longer, or a child at the school that has a chronic disease and needs support and health care in that environment. It doesn't matter if it's for primary care, specialty care, or emergency care, in the home, workplace, a community hospital or clinic. This is about using valuable resources in healthcare more wisely. It doesn't matter if it's a disaster. When the tornado hit up in East Mississippi, we had first responders out there with Google Glasses on, connected back to our emergency specialist here. In preparation for Ebola, we've got telemedicine equipment to be able to minimize exposure but provide quality care. The possibilities are endless. So it's transforming our healthcare system, but let me give you just a glimpse of what's going on here in Mississippi. So this is our 12th year of operation. We've been developing this as a community-based partnership, and it makes our model much different. A model that's sustaining itself and thriving because we're filling gaps around the state. We're not competing. We're finding out what individual communities need and bringing those services there and using our providers and our healthcare resources in the most efficient way possible. And is transforming the healthcare system. So now, 12 years into this, we've seen over 500,000 patients and continue to see nearly 100,000 patients a year. It's remarkable. The penetration and adoption, it's making a difference all over our state. So I told you about this technology that's here and all the options of things that are at your fingertips, of phones and tablets and all that. But I can't go without saying that we're just scratching the surfaces of the possibilities here. The technology is going in the direction of embedded sensors in your clothes and in your shoes. It's going to contact lenses that provide continuous monitoring of your glucose, breathalyzers that are clicked into your smartphone that can diagnose you, or a telehealth kiosk that when you step into it, it has facial recognition and thermodynamics. Then you interact with the healthcare team, all the while a medication drops from the vault and it's dispensed right there in the kiosk. That's where healthcare is going. It's going to be transformative. So if that's not good enough, our network that we have across this entire state is creating a web of support that provides all kinds of things to make communities healthier and stronger. So it's about workforce development and continuing education. When a physician or a nurse practitioner is working in a community, they need education also. So we can connect them back to our academic medical center, and all the education that's going on here, they can get as well, so that the level of care they provide is the latest evidence-based practice. If the person that's a janitor sweeping the floor at the community hospital wants a healthcare career, guess what? We've connected the community colleges to the community hospitals, and he can get that education right there in his workplace. We're making communities stronger, we're keeping people in their communities, and we're all succeeding. So it's about better health care, but it's also about job opportunities, business development, and economic growth. So we've got an incredible opportunity. When we have healthier individuals, we have healthier communities and healthier workplaces, which creates a rich environment for business development and economic growth. Okay, so since this sounds like the best things ever, and it's going to solve all the woes of healthcare, and it's going to do it more timely and cost-effective, why haven't you used it? Why don't you see it? Why isn't it in the mainstream? Okay, so there are barriers. There's reimbursement, policy and legislation, regulatory changes that have to take place. Big ones. See, the policies that were written around healthcare were written a decade ago. So the unintended consequence of that is no one knew telehealth was going to even be a part of our healthcare system. So it limited or even prohibited the use of telehealth. But you know what? Those barriers, while they're not small, they're not insurmountable, and we've done that here in Mississippi. Mississippi got an A rating, one of only 7 states to get an A rating for its telehealth policy and legislation. We're doing phenomenal things here. And the visionary leadership through the state has cleared those barriers. We have reimbursement that's dollar for dollar the same from in-person care to telehealth care. So we have a business model that's sustainable, one that can provide health care more timely and more efficiently, and one that's continuing to thrive. So we've got this incredible opportunity to use this technology, but I'll tell you what, the biggest barrier to me is going to be the healthcare system and the healthcare providers. This isn't what they learned how to do. The business model is one that brings people to the hospital and to the clinic, not pushing it out into the community, into the homes. So we've got to build business models that are financially sustainable, that get the health outcomes that we want. What is the balance between in-person care and telehealth care? We still have work to do, and we've got to do a community awareness campaign to take full advantage of this network that's in our state and it's being rolled out across the world. It's an amazing opportunity and one that we have a lot to look forward to. So this could be the headline news. The U.S. health system is the most efficient and effective. We have an incredible opportunity that's going to make a whole lot of people nervous. There's going to be pushback and concern. It's a change, but one we can't run from. We have an opportunity to transform our healthcare system with the technology that's at your very fingertips. My hope is that we will be able to do that, and that the very barriers to healthcare will no longer be anything about inaccessibility or inconvenience, because it doesn't have to anymore. That our healthcare would be delivered in a community-based, culturally sensitive way, delivering personalized healthcare, all the time saving time and money. So we have an incredible opportunity, so I hope you'll join the movement, think differently, think big, expect more, and help us transform the healthcare system using telehealth. Thank you.